resources both in large-scale incidents as well as small things. And for many of our family services folks, it may indeed be the smaller incidents, single house fires and things like that, where you may have the first contact with folks who are struggling. The red shield, our logo, is still recognized. It said that during 9/11, as planes were being diverted all over the world, and the town of Gander, Newfoundland, doubled their population in a matter of hours. One of the frightened passengers actually looked out on the tarmac and saw a Salvation Army canteen truck and said to the other passengers, "We're going to be okay because the Salvation Army is here." So we really are known for what we do. It has been said that we are often one of the first on the scene and one of the last to leave. However, I think personally that can be somewhat misleading, in that in many cases it's that we are already in the community. Being that we are in 400 communities across Canada, particularly here, we are usually already in that community. So we start out with resources right there locally, and we may bring in folks from other divisions or other places, but certainly when we start out, we are starting out in a community that we already have a presence in. Disaster services is one of those unique things that, every disaster is a little bit different. We don't respond to things with a cookie cutter approach and say, well, we always provide this and we always do it in exactly the same way, because it depends on a number of factors, including what other organizations are doing, what services are needed, what the disaster type is, all of those things. But to give you an idea on some of the things that we do, and particularly we want to relate it to the phases of emergency management. Public safety and other emergency entities within Canada use these phases of emergency management: prevention and mitigation, to preparedness, response, and recovery. And quite often we seem to focus a lot on that response phase, but the other three phases are equally important. So the ultimate purpose of emergency management, according to public safety, is to save lives, preserve the environment, and protect property and the economy. Protection of life is most important. In the broadest sense, emergency management raises the understanding of risks and contributes to a safer, prosperous, sustainable, disaster-resilient society in Canada. So these are the four components, and we'll talk more about those and really what we do as the Salvation Army in each of those four phases. So the first one involves mitigation and prevention. So you can see here the definition from public safety are those things that eliminate or reduce the impacts of risk through hazards, through proactive measures taken before an emergency or a disaster occurs. So really the difference being that not all disasters can we prevent. Things like hurricanes and tornadoes, we can't necessarily prevent those from happening, but we can do things in order to mitigate the risks. So one of the things in June of 2009, Canada announced the establishment of the National Platform for Disaster Risk Reduction, and that's to build a multi-stakeholder coordinated leadership in risk reduction. So trying to reduce our risks, and every year Canada does hold a national platform with key stakeholders to discuss risk reduction. As well as then there's a regional platform for the Americas, and then there's also a world platform where countries from all over the world get together and talk about how we can reduce the risks. So the Salvation Army is represented on Canada's platform for disaster risk reduction. That's one of the ways that we are involved in the mitigation prevention area, is being involved in that way and finding out what it is that the Salvation Army can do. We're also part of the Canadian Tri-Services Emergency Management Committee and the Canadian Risk and Hazards Network. So these are all part of the mitigation and prevention piece, talking about ways that we can help to mitigate the effects and what can we do in order to be ready and make those things that we can't stop, what can we do to minimize the risks. Moving into preparedness, of course, would be efforts, again, prior to an emergency, aimed at making communities safe and more resilient. So this would include things like training, planning, exercises, talking about those lessons learned. And one of the key things that has been learned in emergency management over the last number of years is that it really does need to be just that, lessons learned, not lessons observed. So if we see that there's an issue or things that could have been done better, but we don't make any changes, then we haven't really learned the lesson. All we've done is observed it, made note of it, but we haven't done anything to change the way that we do things. So more and more trying to focus on that lessons learned and what can we do. And that involves things like after action reports from previous disasters, trying to make things better. So one example you may have heard of recently regarding preparedness is the new National Public Alerting System. You may have heard with cell phone carriers where they've had to open up and be able to send text messages, and it is all done by where you are located. So if you were in the area of a disaster, and it is life-saving information saying to evacuate. So things like the Fort McMurray fires, where you can actually send people a text message that they can't opt out of to tell them it's time for you to evacuate. So this would be an example of a preparedness measure. Within the Salvation Army, part of our preparedness, of course, is training. We have our National Disaster Training Program, which is a comprehensive training program going through the full sphere of the training and the resources that the Salvation Army can provide. We do also have folks who are able to train in critical incident stress management, which, if you're not familiar with it, would be similar to a psychological first aid to help people deal with the stress and trauma. And this is an area, again, that can overlap with our community and family services offices, because it's critical incident stress management is not specific just to disaster response, but it is stress management as a whole, and dealing with people in crisis, which many of our offices do all the time. And of course, then being involved in emergency exercises, mock disasters, whether those are tabletops or full-scale exercises. So we would certainly encourage folks to be involved in those within your community. By law, every municipality has to have an emergency plan. It is legislated, so they do have to have an emergency plan, and part of that is that they also do have to perform exercises of some kind, whether it's a tabletop or a full scale or something in between, every year. And so, certainly encouraging folks to reach out, find out where those opportunities are, and it's a great opportunity to practice in a less stressful environment. Another way that we are involved is through Emergency Preparedness Week coming up. It's always the first full week of May across Canada that Public Safety Canada hosts Emergency Preparedness Week in partnership with the provinces and territories and other key stakeholders, including the Salvation Army. And we have, again, been a part of a multi-stakeholder planning group for Emergency Preparedness Week, talking about how we are going to continue to put out that public safety message and the preparedness message. So you can see from the flyers, we are going with what public safety has deemed the national theme, which is to be emergency ready. And then we are focusing in on three key components within our organization for how we can be ready. And they are to develop a plan for you and your family, to get an emergency kit, and then encouraging folks to be able to join our team and be ready for when disaster strikes. Because often what we will find is both people from within our organization and externally, when something major happens, are wanting to help and are wanting to volunteer. But unfortunately, at that point, it's too late. We can only deploy pre-trained, pre-screened folks to a disaster site. So part of our messaging is to say, if it's something you think you might want to be interested in when something happens, now would be the time to start building those relationships and getting that training and getting on the lists and getting credentialed so that you are available when the time comes. And so these materials have been sent out as well to all of the divisions, along with posters, postcards, and a short video that can be shared with folks, encouraging them during Emergency Preparedness Week, encouraging our folks and externally to really be ready for an emergency. And then along with that, we recently announced our upcoming Territorial Emergency Disaster Services Conference, which will take place next April. A year from now, we will be right in the middle of it. It will be held in Ottawa, Ontario, so certainly be checking our website for more information on that. But we look forward to having people there and really helping to increase our own ability to be able to respond to disasters. What has usually been the biggest phase of emergency management is that response phase. And of course, that is again to provide immediate assistance to maintain life, improve health, and support the morale of affected populations. Emergencies are managed first at the local level. So as an example, by first responders, such as medical professionals, hospitals, fire departments, police, municipalities, local authorities who need assistance request it from their provincial or territorial governments. And if an emergency escalates beyond their capabilities, the province or the territory can seek assistance from the federal government. But response always starts locally. Things that we as the Salvation Army provide, and again, this is not an all-encompassing list. It's not always provided every single time. But of course, emotional and spiritual care, being that we are the Salvation Army, is a key component of what we do. And that can be everything from trained chaplains providing support to meet and greet services, people who are being displaced being met at a reception center and greeted and just warmly welcomed, to critical incident stress management interventions, but understanding that we respect all faiths and beliefs, and we can have an interfaith team in that during a disaster, if somebody comes to us and says, you know, I'm Jewish and I want to talk to a rabbi, we're going to make that connection for them, not try and convert them to Christianity. So a big component of what we do, and I think the biggest piece sometimes of that is what we would call our ministry of presence, and just being there and being a listening ear, giving people someone to talk to. Again, fixed feeding, so whether that's in one of our own buildings, a community center, most municipalities pre-designate what they would call an evacuation center or a reception center or whatever for folks who have been displaced. And so many times the Salvation Army's role in many emergency plans is to provide food and drinks to those folks that are evacuated or out of their homes. So using certified kitchens, being able to prepare the food, and that's part of our training program, is teaching people about menus and how to prepare food in an emergency. It is very different than it would be just doing it for a regular event of some kind, whether it be a church event or other things. So there's a lot more to it, being able to provide mass feeding to people. And then of course we have our mobile feeding, which are done through what we call our community response units, which are mobile canteens, food trucks. They are strategically placed around the country to be able to provide food to both those who have been affected by a disaster, as well as the first responders and workers who are responding to it. And it is often one of the first things that we do. It's kind of one of the main well-known things that the Salvation Army is known for in disaster response, is being there. And one of the advantages is that with these mobile things, people don't have to come to us. We're able to bring it into the areas that it's needed most. Of course, social services in a disaster. So focusing on those essential needs, whether it's food, clothing, shelter, life-saving medications. In some cases, we may be providing financial assistance through things like vouchers or gift cards, prepaid Visa cards, whatever, for folks to be able to get those essential things that they need right away. Includes things like those personal needs and hygiene kits, any of those things that people need, especially in the early phases of a disaster. In the long term, and this one actually sometimes goes into our long-term recovery piece, we may need to do things like a disaster assistance center where we're providing a little bit more long-term support for folks as well. Donations management is another big thing. Because it's something that we do every day, particularly through our thrift stores, is managing of donations. And one of the things that you will always hear organizations, the Salvation Army, as well as others say during a disaster is that monetary donations are the best way to help. And that's not because of organizations being greedy or just wanting the money or wanting to use it for other things. There's three main reasons for that. One is it's much easier for us to send money to the affected area than it is goods. It's much more cost effective to be able to do that. So an example would be, after the earthquake in Haiti, we had calls from folks wanting to donate blankets for Haiti, and it would have cost the Salvation Army about $50 each per blanket to send them to Haiti, but we could purchase a blanket, a brand new one in the Dominican Republic for $5 and not have any shipping costs at all. So it really isn't a good use of our resources to be able to do that. The other thing is we can buy the things that we actually need, not just what people think we need. And then the last reason, of course, is that we try to purchase items as close to the impacted area as we can in order to help stimulate the local economy. So that is some of the main reasons we do that. When we say all of that, many times items will come to a disaster regardless of whether you've asked for them. So often we are tasked with that job of getting those items, sorting them, and distributing them to the people who need them most. Communications, we already mentioned Canada's new platform for being able to get out messages through cell phones. SATERN was started 30 years ago by a Salvation Army officer in the United States to provide communication support. It originally started out as amateur radio operators providing communication support. SATERN has since expanded to include really all of our communication, and whether that's things like health and welfare information, setting up a network somewhere, they are communication specialists, being able to provide that communication support. And although there's a lot more redundancies in our technology these days with cell phones and satellite phones and other things, situations do still happen where all of those things are down. Cell towers are knocked out, satellites are not accessible, and so at times we will still have to rely on amateur radio as the only form of communication. And then last, we look at long-term recovery. So you can see out in British Columbia, they've described recovery as coordinated set of actions designed to reduce the effects of a disaster. A recovery program implies a deliberate effort to forestall and overcome the adverse impacts of a disaster. So it is the efforts of communities to recover from an emergency, and they're often tragic consequences, the ability to recover from physical damage, injury, economic losses, and human suffering that have resulted from a disaster. Some of the things that we do regarding long-term recovery and have done in recent years would be cleanup kits. You can see some in the picture there that we worked with some partners last year after the flooding in Ontario and Quebec to provide some cleanup kits in neighborhoods in Quebec, and being able to deliver those to people. And those cleanup kits have, after flooding, would have things like mops and buckets, have cleaning supplies and masks and things that people need in order to help them clean up and avoid mold after flooding situations. The other piece can be that long-term case management with folks. And sometimes it's even getting them in touch with other programs within the municipality where they can maybe get some of that long-term help. This is some of the stuff that's done once the cameras are off. Many cases, it's months, even years after the disaster that there is still work being done on long-term recovery, helping those who have been most impacted recover from the disaster. All the cameras are off. There's not news coverage necessarily happening anymore, and that's when this seems to happen. So really, really important piece to things. At all phases, we work in cooperation with other organizations. You can see there a list of some of them. No organization can do everything, so we work very closely with our partners in other organizations to provide support. In many cases, if there is a gap, the organizations along with municipal social services will often get together, discuss the gap, and try and determine who's best to meet that need. And in many cases, it might be multiple organizations partnering together to meet that need. When I first started in emergency disaster services, I was told that we don't have disasters in Canada. But as you can see from this list, things that the Salvation Army has been activated for within recent years, there certainly are disasters in Canada, and they seem to be on the rise. And so more and more municipalities and others are in that preparedness phase, trying to be ready, because we do know that these things are happening. We don't believe it's a matter of if a disaster happens again. It is really a matter of when and where specifically it's going to be. Now, if we can get this technology to work, I just want to play for you a short video that was done by the Alberta and Northern Territories Division following the Fort McMurray fires, which will give you an idea on the work that the Salvation Army did in Alberta.
It was all night we worked. We didn't sleep. What was for us astounding was sometime early in the morning, Major came in and he asked us if we wanted breakfast. And that was like a godsend.
Many of the staff, they could have left the center and stayed to support the clients that were coming in. Went out and had to alert them that you know you want to be here on our behalf, but you need to now take care of yourself. And there is a mandatory evacuation.
Normally we drive towards the disaster out west, so it felt a bit different to be doing that. It wasn't that long after the evacuation, the phone rang and said, how fast can the Salvation Army get back in here with some of your canteen trucks to receive the first responder?
We went into Fort Mac and we served in front of the Emergency Operations Center, but it ended up air quality got so bad up there. We had our masks on, but you could see the soot on our arms. So they moved us into the fire hall. we became the coffee shop of Fort Mac. There was nowhere else for them to go.
With anyone around the truck, it was always a happy environment. And that's something that gives you a sense of home. You don't necessarily have one. Quite often,
yeah.
Shake a hand and they go, oh no.
I'm not going to bother. Okay, I'm not going to bother. As far as this snowball watches, I can't do anything.
That's too bad.
Sorry, yeah. It's not going to come back, so I know.
And so we went out there and we were able to offer snacks and of course spiritual and pastoral emotional care. Supply water for people's houses. Oftentimes what would happen is we carry the water out to the trucks. So they would come in and they'd have opportunity to talk to people and that sort of thing. And they're like, no, I just want to get stuff done. I'm good. But it was in carrying the water to the trucks, to the trunks of people's cars. People just started opening up. So much of what we did was being able to listen to stories and being able to just support them.
We had thousands and thousands of people coming through here for footwear, clothing, bedding, house, kitchen items.
Everyone had a story to tell. So I found that the biggest responsibility we had in the earliest, like in the early days when people started coming back, was really about giving a listening ear. You hugged everybody that came in because you were so happy to see them and to know that they're okay.
I want to say thank you for your help. For those of you that volunteered, whether in Fort McMurray or other parts of Alberta, you really made a difference. For those that donated food, clothing, household goods, as well as monetary gifts, without your help, we can't do what we do. So together, we made a difference. God bless you.
All right, so let's look at the disaster response process. Who is it really that does what when it comes to our Salvation Army response? So to give you an idea, as I mentioned before, all responses start locally. They would initially start as a local response. So if we look at one of our divisions, we'll look at the Prairie Division. You can see Prairie Division's divisional headquarters is in Winnipeg. They have other ministry units in Saskatoon, Regina, Brandon, and Fort Frances, Ontario. So let's say a tornado strikes Saskatoon. What would be the Salvation Army's response? Well, initially, a local unit from Saskatoon would respond. And it doesn't matter whether they have a canteen truck, one of our community response units. They would start with whatever they had, whether that's coffee out of the trunk of a car, start with the resources that they have, being able to provide whatever support that they can, and whatever might be in the local plan or local agreements. If the local unit then gets overwhelmed, they would contact their divisional headquarters, and the divisional headquarters would put out a call to other units within the area and start out within their division where they would have teams. An example of that would be, I know Shannon Daniels is on the line. During the Goderich tornado, teams from other parts of southern Ontario were deployed to Goderich and helped out with response efforts to support the local team. But the initial response started as a local response. So those other units would respond, provide support, whether it's personnel, equipment, resources, whatever it is. If the local unit is still overwhelmed, again, they would contact their divisional headquarters, and if the division, if it's beyond their capacity, that's when then divisional headquarters would contact my office at territorial headquarters, and then additional resources would be deployed from other divisions. That's all done through territorial headquarters. However, the command remains within the division. So other resources that are then deployed, whether it's personnel or items, would then become under the command of the local team and the division right there in Saskatoon. So at a local ministry unit level, whether that is a core, a community and family services, within a local municipality, our local folks' role would be these things, because they do start as a local emergency, getting a team leader and team members, coordinating that delivery of assistance, building relationships with the local responders, whether that is the fire department or the police department. Every municipality also has a designated community emergency management coordinator. And so the CEMC is the designation, building the relationship with them, finding out what role the Salvation Army can play. If we are part of the plan, what is it that is being expected of us? Arranging and attending training events, keeping the division informed of any responses that are happening, also sending out after action reports. So even if it's responding to something that the local unit can handle on their own, it's still wise to keep your division informed of specifically what has happened and where, because in many cases, even though it might not be a larger scale response, it could be a national news story. An example would be just within the last week, the incident in Toronto. A local team responding there would have been able to handle any response that was needed, and the Salvation Army did indeed offer support. However, that was a national and in fact international news story, so it would still be important for the division and then the territory to be aware of what response had taken place. As well, looking at least the initial stages of developing memos of understanding with a local municipality or with other partners. Although these can't be signed locally, the initial discussions and working on those details would be part of the local unit's role. Divisionally, their role is allocating additional resources from within the division, having a divisional response plan, the establishment and training of a policy group who would provide the overall strategic direction to a response, supporting a ministry unit's programs, building relationships with other responder groups and within the division. And again, specifically if it's provincial or regional, that would be a division's responsibility, and helping to facilitate the delivery of our training program within the division. And finally, THQ's role is acting as a liaison with counterparts nationally and internationally, liaising with our federal government departments, including Public Safety Canada and Public Health and other national organizations, maintaining our database, oversight of our territorial team, our facilitation of our training program, as well coordinating the deployment of personnel and resources between divisional boundaries or to other territories or from other territories. So to give you an example, these are circumstances where THQ would need to be involved. Resources, if they're required from outside a specific division where the impact is, if more than one division has been impacted or is involved in the response, if we need to initiate a fundraising campaign, or if it captures any national media attention. linkages between emergency disaster services and family services. We mentioned earlier that social services piece. Often the best people to help with some of those social services things are our community and family services workers who do it every day. And in many cases, that as well as the long-term recovery, oftentimes in a municipality, in the area of impact, it's those folks who are going to be highly involved in those pieces, particularly in the long term. So even if people come from outside other areas, eventually command will be sent back to the local municipality, and certainly our family services people are the best qualified to be able to do that, as well as providing that case management piece. And then the last one is what we would call personal disaster assistance. So that again is that house fire where a family has maybe been displaced. It isn't something that has made major news. We didn't have to deploy a canteen or provide other things, but they come into a local community and family services office looking for additional support. And it might be outside of just food bank support, but looking for other support and assistance from us. Because it's one family. So it may not be that we've put out an emergency disaster services team, that we've deployed any other resources, but that they're coming to us for some personal assistance due to a personal disaster. So we've got just a few minutes left. I'm going to unmute everyone. So if you do have any questions, if you do have a question, if you could please just identify yourself, your name and where you're from, that would be very helpful.
That's annoying.
Somebody's got some beeping going on, if you could. So any questions? So I've just hit mute on everyone. If you do have a question, just unmute yourself. Then we don't have to hear all of the extraneous noise. All right, so I did get a question online here regarding the response to the events in North York. So the Salvation Army did reach out to Toronto Police and offer support, and they were most appreciative of that offer. A team was put on standby. However, we were not asked to officially do anything. Everything was under control, and so our assistance was not required, but we certainly did reach out and offer any support that might be needed. So that is a good question. Other questions? You can either unmute your phone or send it in a message. All right, nothing heard. We will, I guess, end our webinar for today. Thank you, everyone, and hope you have a great day.
Thank you.
Thanks, you too. Bye now.
Thanks, Faran.
Thank you.
Thank you.